How is active myeloma defined?
Right. So when patients initially present with a plasma cell disorder, we have to characterize whether or not someone has a precursor condition, such as MGUS, or smoldering myeloma, or whether or not they have systemic myeloma that requires treatment. The actual level of M protein that defines myeloma, technically speaking, is 3 grams per deciliter. But practically speaking, the level of that M spike protein is not, in and of itself, sufficient to identify individuals that require treatment. The myeloma defining events, as they have been relatively recently updated, include presence of what we call CRAB criteria, hypercalcemia, renal disease, anemia, bone disease, or several myeloma defining events, including focal abnormalities on an MRI, a bone marrow plasma cell percentage above 60%, and a free light chain ratio over 100, with the involved light chain being 10 milligrams per deciliter or greater. So on some level, the free light chain ratio in and of itself may be a myeloma defining event, or has been characterized as a myeloma defining event. So with a ratio over 100 and an involved free light chain over 10, one needs to discuss with their physician whether or not it's appropriate to initiate myeloma treatment at that time. A similar number for M spike doesn't exist per se. However, if one has on serial examinations, several 2, 3, or 4 sequential examinations over a limited period of time, rising M protein, that does suggest that one needs to revisit the question of whether or not any additional CRAB criteria or myeloma defining events are present, because that's a situation where trying to prevent systemic issues developing from the disease is important.